am a diagnostic medical sonographer. We use high frequency sound waves to produce images in the body. We look at small parts, we look at the abdomen, the pelvis, we can look at the fetus inside mom, we look at baby hips, baby brains. There's so many different things that you can use ultrasound for. There is no radiation, so it's safe for patients, it's painless, and it's really the preferred modality, I think, amongst radiologists and physicians alike, because it is non-invasive for them. The workday can vary. So with ultrasound, you can have an inpatient position or you can do an outpatient. So as far as outpatients, you're looking at about 6 to 10 exams a day. Each exam takes about 45 minutes is how much time you generally have for each exam. It doesn't usually take the whole 45 minutes to do an exam, but it will take you anywhere from 15 minutes to about 30 minutes, and then you'll have some time on the back end to clean your rooms and get prepared for your next patient, go talk to the radiologist about the study. Obviously, sometimes exams are really quick. You have a perfect patient that's beautiful and easy to scan, so you can get them in and out. But sometimes you have really difficult patients that you have to help move or you have to assist in whatever it is that you're doing for the day. So the workflow can vary, but as far as an outpatient setting, you have an 8-hour day and then you get to come in and you go home. Inpatient is very different. You have to accommodate the inpatient exams, but you generally have an outpatient setting as well. So you'll have outpatients that you go get that are just kind of walkie-talkies, easy people that can come into the hospital, but inpatients can be very different. So ultrasound also is used for biopsies, for masses, and to be able to do procedures like a paracentesis or a thoracentesis or abscesses or drains. You know, there's a ton of different procedures that the radiologist will use ultrasound for. And so that can be really difficult and really tricky to kind of plug those people in when you already have a full outpatient schedule. So very different. I prefer to have an inpatient setting just because you never know what you're going to get throughout the day. Things are not as easy, so I like to have the challenge. I like to work with the radiologists and all the different departments and scheduling those things to make them happen for the patient. And for me, it's a bit more rewarding than just an outpatient setting. You're always working as a team. In the medical field, don't ever think that you're working alone, because you're not. You're working with the schedulers, you're working with patients' families, you're working with physicians. I mean, there's just so much that goes into each and every exam. So it's important to think about all those roles that go into every single patient, even EVS or food services or anything like that. Individually, you work individual in a room. So you are in complete control of your room. It's you, the patient, and the ultrasound machine. Except for biopsies, obviously you have to have, the doctor and nursing staff in there when you do those things. But it's just you and the patient. So you really have to own your room, know what you're looking at, know what you're doing, make sure that you hold yourself in a professional manner. We occasionally go to surgery, but I would not say that that's very often. We will assist with DNCs and different procedures to make sure that everything is done, or like with vessels to make sure that there aren't pseudoaneurysms or complications with that. But typically we don't go to the OR, and it's usually like an emergent setting. But once you're in your room and you're done with your patient, then you have to come back out, and then you work with a huge team of people. You have to coordinate different procedures, different things throughout your day. Sometimes they want to do add-ons. Sometimes they, you never know what's going to get thrown at you for the day. So you have to work with the team and the people that you work closely with, as far as the other techs that are there. So you're always working in a team, but in your room, you're as an individual. You don't really need a whole lot of help, I would say. Work-life balance can be tricky. We take a lot of call in ultrasound. And so part of that, that can be difficult on people and their families. On call, most places are on call from like midnight until 7 a.m. and the likelihood of you being called in is pretty high. And so most people, I would say, do not enjoy taking call, because once they get called in, then they're up for the rest of the day. They can't go back to sleep once they go home. And sometimes you don't go home. And so that can be really hard on people and their families. But as far as work-life balance, I would say that it's actually pretty good, as a whole. Besides the whole call thing, going to work and coming home, there's not a whole lot that you have to take home. Like there's not work that you have to do from home. So when you do clock out, that is the end of your day, which I think is a benefit for most people. I worked in the lab previously, and so I was able to see all over the hospital. I got to see, what the nurses do and what doctors do and what imaging staff does, but I only got to see a very small portion of those things. And so I Googled what 2-year degree makes the most money. And it was ultrasound. And so I just started taking classes for ultrasound. Had no idea what it was or what I would be doing. I thought that it was all babies, which is typically what everybody else thinks. And so I just started one class at a time. Look at what your local school has and just start taking classes one class at a time. I think that for most of, X-ray, most of the medical field, like as far as like a technologist or a technician, you are taking all of the same classes. So just start taking one class at a time. And once you get to the point where you can actually apply to a program, there's very few variations. Physics is one of the big ones for ultrasound, and I think that a lot of people get nervous about taking a physics class, but just like anything else, they give you all the tools that you need to be successful in this program or to be able to be successful in your class. It's not any different. So if you really have your heart set on ultrasound, take the classes. You can do it. Everyone can do it. Something that I wish that I would have probably known is that the rate of work injuries is really high in ultrasound. It's actually 90% from the SDMS website. That's something that I didn't take into account prior to investing so much time in this career. Shoulder injuries, lower back injuries, wrist injuries, those are just a few of the things, but it's 90%. I looked it up today. And people end up not being able to stay in this career for very long. And those statistics come from like 6 months to 5 years to 10 years. So we're not talking 30 years in this field and all of a sudden you have an injury. These are kind of short term in your career. So the longevity I don't think is necessarily there. We see a lot more people going back to school for ultrasound, which I think is great because you're already kind of towards the end. And like I said, you make really great money in this field. But if you're starting out as a fresh 20-year-old, it can be really difficult and kind of a scary thought to think that you're really going to hurt yourself. We work very closely with radiologists. There has to be a high level of trust. You are the eyes for the radiologist. Everything is in real time, so you can see the blood flowing through the vessels, you can see the fluid moving, you can see the baby moving, and you can take videos of all those things. But it's different when the radiologist has the opportunity to scan or to see things live. And I think that that's very different from the other modalities. They really have to take what you say as the truth. And so when you're taking pictures of something, even though you know that whatever it is, say it's a mass or something that's horrible for this patient, you need to do everything that you can to document the characteristics of whatever it is that you're looking at so that the doctor can make the most informed decision about whatever it is that's going on with this patient. I think that some ultrasound techs feel bad for patients or like they feel like they're, like how is this going to impact their life? When really it might be a terrible thing for them to find out that day, but then they get the treatment that they need and their families are informed. And the outcome is so much better if you take that extra time to be able to take those images for the radiologist. But they have to know that you're willing to do that and to be able to trust you. So being really thorough and taking time, really making sure that you're looking at everything is so important with ultrasound because there's so many things that you could potentially miss that you don't want to. Ultrasound is growing rapidly. From 2010 to 2020, they said that the ultrasound field is growing at 44%. So there's a lot of growth within ultrasound. They're using it more and more for procedures and for Like I said earlier, the preferred modality amongst all of imaging because it is non-invasive. So there's tons of opportunity for a job if you are wanting to go into ultrasound. In Washington, it's a little bit more difficult. I know that some other states they do like dual imaging, stuff like that. But here in Washington, all I have seen is mainly general. So you have to pick between general and say like echo. So there's specific classes that you would have to take to be able to be an echo tech versus just a general ultrasound tech. You can get cross-trained into maternal fetal medicine, which is kind of the elite group, is how it was described to me, of ultrasound techs. But I mean, it's just whatever it is that you want to focus on. There are some places that still will train you in vascular, but it's kind of phasing out. They're separating the two labs. So one is general, and then the other one just does vascular. I got trained in some vascular, but I'm not a registered vascular tech. I wish I was. Yeah.